Welcome to this explainer. Today we're diving into something that is quite literally changing lives. We're talking about a shift in medicine, specifically how modern robotic technology is transforming spine surgery. Taking it from what used to be a grueling multi-day hospital ordeal into a highly precise, same-day outpatient experience. So let me ask you something. What if spine surgery meant sleeping at home tonight? For a really long time, the absolute biggest fear surrounding back surgery was the long, painful hospital stay and just the massive disruption to your entire life. But what if all those assumptions about recovery are completely outdated? Well, a generation ago, even routine spine procedures meant long incisions, major muscle disruption, and days stuck in a hospital bed. But today, it's a totally different story. Thanks to some incredible advancements, those exact same procedures are often done through surgical corridors as small as just 1 inch. And the best part? Patients are walking out and heading home the exact same day. Section 1. A new era of surgery. Changing what you recover from. Now, it's important to understand that the underlying surgical problem you might be facing, that hasn't changed. A compressed nerve is still a compressed nerve, and the medical goal is exactly the same. What has changed is how the surgery is planned, guided, and performed. The technological execution is just light years ahead now, and that perfectly sets up the introduction of advanced robotic systems. Section 2. How robotic guidance works. Precision planning and navigation. Before we get too deep, we need to clear up a common mix-up. Robotic guidance and minimally invasive surgery are actually two distinct things. Robotic guidance is a precision support tool used right there in the operating room. Minimally invasive surgery, on the other hand, is the actual physical approach, using those smaller, muscle-sparing incisions we talked about. So the robot is simply an amazing tool that perfectly complements that less disruptive surgical technique. Let's completely demystify what's actually going on in the operating room. Using the advanced Mazor X platform, the workflow basically breaks down into 3 fascinating but easy-to-understand steps. Step 1. Your surgeon maps out the exact hardware trajectories using CT or X-ray imaging way before the operation even starts. Step 2. During the surgery, the platform perfectly aligns that pre-built plan to your real-time exact anatomy. And Step 3, the system guides the surgeon's instruments right along that path with sub-millimeter precision. Section 3. Precision meets minimally invasive, shrinking the surgical corridor. Think about it like this. The narrower the corridor, the more valuable the sub-millimeter precision becomes. When a surgeon is working through an incision that's barely an inch long, they obviously don't have that wide-open visual field of traditional open surgery. So having an advanced robotic system mapping the exact trajectory, it is an absolute game changer. And the data totally backs this up. A 2025 meta-analysis looked at pedicle screw accuracy. Conventional techniques hit about an 85.1% accuracy rate, which is okay, but with robotic-assisted surgery, that jumps to 94.2%. That is a massive boost in accuracy when you're navigating complex spinal anatomy. But wait, the numbers actually get even better, 98.6%. A 2024 study out of the Hospital for Special Surgery analyzed over 1,200 pedicle screws. They found that when using robotic arm guidance for these complex screws, surgeons achieved a near-perfect 98.6% accuracy rate. That's just phenomenal. For anyone feeling anxious about spine surgery, and let's face it, we all would be, this data is incredibly reassuring. Because this sub-millimeter precision directly translates into safety. Neurological injuries drop from 4.3% down to 1.9%, and revision surgeries fall from 5.2% to 3.1%. In simple terms, better accuracy means lower complication rates and a safer, far less disruptive experience for you. Section 4. The surgeon leads. The robot supports the plan. Okay, let's rapidly clear up the biggest myth in the room right now. No, a robot is not autonomously doing your surgery. Let's be crystal clear about what robotic guidance does not do. It doesn't make the clinical diagnosis, it doesn't build the surgical plan, it definitely doesn't replace surgical judgment, and it doesn't magically eliminate all surgical risk. Honestly, think of the robot as a highly advanced GPS tool. It's an incredible navigation aid, but it is not the pilot. The absolutely crucial takeaway here is this. The technology supports the plan. It's your surgeon who builds the plan, leads the operation, and decides literally every step of the way. Robotics and surgical judgment work together. You can feel completely safe knowing an expert, highly trained human is always in control, just using amazing technology to execute their customized plan perfectly. Section 5. The Vertrae difference. leading modern outpatient spine care. So, where does all this come together? Well, the Vertrae model really represents the undisputed regional leader for this exact type of advanced, precise care. Vertrae is a spine-only outpatient surgery center led by dual fellowship-trained Dr. Kamal. They specialize intentionally in minimally invasive techniques, and they've fully integrated the Mazor into their routine workflow. They didn't just buy this technology as some fancy accessory, they've built their entire outpatient philosophy from the ground up around tissue preservation and modern, sophisticated recovery. And what does that philosophy actually mean for you, the patient? Well, weeks before, you get custom preoperative planning and imaging. On the day of surgery, you undergo precision, minimally invasive surgery guided by the Mazor X. That very night, you're discharged to sleep in your own bed. And just weeks later, you're back to walking the dog and living your life. Walking out the same day and recovering quickly at home isn't some pipe dream anymore. It's the reality of modern spine surgery at Vertrae. Which brings us to the core philosophy and really the main takeaway of our explainer today. At Vertrae, advanced technology and surgical judgment work perfectly together, built around precision, tissue preservation, and modern minimally invasive recovery. This truly cements Vertrae at the leading edge of modern minimally invasive spine surgery in Southwest Ohio. Finally, I want to leave you with a question to really think about. Are you ready to see how modern spine surgery fits your case? If you've been living with spine issues and dreading those outdated surgical methods, don't wait. Bring your imaging, bring your questions, and bring your second opinions directly to Dr. Kamal and the Vertrae team. It's time to find out exactly what modern, highly precise, outpatient spine care can do for you.